Madam President, I come to the floor today to acknowledge those members, but also to speak on the business before the Senate today, and that is the question of whether or not to proceed to debate on the Patient Protection and Affordability Act, a bill that is the best work of the Senate to date on a subject of significant importance to the people of my state and the country. My vote today to move forward on this important debate should in no way be construed by the supporters of this current framework as an indication of how I might vote as this debate comes to an end. It is a vote to move forward to continue the good and essential and important and imperative work that is underway. After a thorough review of the bill, as I said, over the last 2.5 days, which included many lengthy discussions, I've decided that there are enough significant reforms and safeguards in this bill to move forward, but much more work needs to be done. Over the past many years, and in particular the last 6 months, I have heard from people all across Louisiana that their insurance premium costs are simply too high and continue to rise without warning, threatening the financial stability of their families and their businesses. I have also heard the pleas and cries of many people who need coverage, health coverage, but they can't find it anywhere within reach of their budgets. Through months of public meetings in VFW halls, school gyms, and in hospitals and health clinics, from New Orleans to Shreveport, in large and small communities throughout my state, it is clear to me that doing nothing is not an option, nor is waiting any longer for this debate to begin, to continue, and to come to some final conclusion. Spirited debate and good faith negotiations in this Senate have produced a bill that contains some amazing and cutting-edge reforms that will, I am hopeful, reduce costs for families and small business while reducing the debt burden of the federal government. But these reforms must be implemented properly and carefully, and they must be put in place in a timely fashion. Small business owners across the country have told me time after time, in order to remain viable and create the jobs they want to, and Madam President, may I say, the jobs we need them to create if we're going to work our way out of the recession that we're in, they need affordable health insurance, and they need stable and predictable costs. Yes, they would like their costs to be lowered, and I'm going to stay focused like a laser on doing that. But what they also need is predictability, simplicity. They need to be able to plan, and so they can get to their job, which is creating jobs, and not finding their way through very complicated and limited choices under the current situation. As we all know, the current situation, small business owners are frequently confronted with impossible choices. When an employee or an employee's family member gets seriously ill, they can expect exorbitant cost increases of the meager plans and choices they have, or they can go to that employee and those family members and say, I'm sorry, to save my business and the other 10 employees, we need to let you go. Here's $1,000 or $2,000 or $5,000. You're on your own. Good luck. That is a tragic story, painful and depressing, and it has to stop. So I appreciate the hard work of many, many business owners and organizations that have helped to craft portions of this framework, because they have remained at the negotiating table. They didn't run and hide. They remained at the table. I'm asking them today to stay at this table.